Dear students, today I am going to discuss about the topic trichomoniasis. Trichomoniasis is a particularly uh, disease that can be caused by a protozoan parasite, and this protozoan parasite, which is named as Trichomonas vaginalis. This is a tiny single-celled or unicellular parasite. Trichomoniasis is a disease which can also be termed as TRS, and short form of trichomoniasis, and is a common sexually transmitted disease among both the human, both the male and female. So anyone who is sexually active, he or she can get this particular disease infection by this particular parasite. And this particular parasite actually affects both the genders, but affects more females rather than the male. And there is a differences in the gender of the in the age group of the woman also. Mostly the older woman who can get more infection rather than the younger woman, and the research has also exposed the data that the African American woman can get more infection than the white woman, so Native American woman. So people with Trich often don't show any symptoms. Mostly they are asymptomatic, and it does not usually cause problems. But if some individual don't get treatment, and it raises the chances of getting spreading other sexually transmitted diseases like human hepatitis virus. So now I'm going to discuss about what is Trichomonas vaginalis or trichomoniasis. So trichomoniasis, as I said, that is a sexually transmitted infection, sexually transmitted disease. First, this particular disease was discovered in 1836, so it's not at all a new disease. Dunn was first discovered this pathogen and observed the pathogen, which is a flagellated unicellular protozoa in 1837. And why should we go for the study of this particular disease? Because worldwide, 180 million people get infected by this particular parasite. And mostly this parasite resides in the genitourinary tract of both the females as well as male. And most of them are, the infected persons are asymptomatic carriers. So Trichomonas vaginalis in its trophozoite form inhabit in the vagina of female and the prostate and seminal vesicles of the males and urethra of both the sexes. So this is their natural habitat. Now, what are the characteristic features of Trichomonas vaginalis? So Trichomonas vaginalis is a unicellular parasitic protozoa or pathogenic protozoa that do not possess any cyst form. So, like the malarial parasite or amoebiasis. So they are flagellated. They have 4 flagella and they are facultative anaerobic parasites. So this is their systematic positions. So they fall in the phylum known as Metamonada, subphylum Trichozoa, order Trichomonadida, and family Trichomonadidae. The genus is Trichomonas and the species is Vaginalis. This is the systematic position. So now I'm going to get the structure, morphology of Trichomonas vaginalis. So the structure of Trichomonas vaginalis, or the morphology. So Trichomonas vaginalis trichomonoids are approximately the size of white blood cells, approximately 10 to 20 micrometer long and 2 to 14 micrometer wide. Although this may vary in size. And trichomonoids have 4 flagella that projects from the organism's anterior portion. Here you can see the anterior portion, and 1 flagellum that extends background here. This extend background across the middle of the organism, forming an undulated. Here you can see this undulated membrane, forming an undulated membrane, and also they're forming an exostyle. So an exostyle, which is a rigid structure, extends from the organism anterior part to the posterior part. Now, what are trichomonads? Trichomonads are any protozoan of the two flagellates in the order of Trichomonadida, and they have 3 to 6 flagella, and one commonly borders an undulated membrane or undulating membrane, and they may be nucleated or multinucleated. So these 4 flagella that are present at the anterior end, they are distinguishing Trichomonas from the closely related organisms that also have different numbers of anterior flagella. And also you can see different granules. These granules are known as chromatin granules. There are 4 different granules or different numbers of granules on its exostyle. And also they have chromatid basal rods here and some parabasal fiber. You can see here these are the parabasal fiber, and this is the chromatin basal rod, and these are the chromatin granules that are present among its exostyle. Along with that, they have a particular membrane enclosed organelle which is known as hydroxymosome. So particularly anaerobic ciliates, trichomonas, fungi, animals, they contains this membrane enclosed organelles, and this is their characteristic features. So Trichomonas, especially living at high pH conditions. So the preferred pH 5 to 6. Now this is the structure of Trichomonas vaginalis. So at this the base of this flagella, you can see here the base here. This is the base of the flagella, the anterior portion of the Trichomonas species. They have parabasal bodies, a kinetosome accompanied by Golgi stacks. Here, the kinetosomes are a structure in some flagellated protozoans, which forms the base of the flagellum, consisting of a circular arrangement of the microtubules. Then we have the other structure which is known as pelta. This pelta is nothing but the sheet-like structure of the microtubules that actually curve around the flagellar bases. And the posterior part of to the pelta is actually the exostyle. This is the posterior part of the pelta, and this is actually known as exostyle. So this exostyle is nothing but a bundles of microtubules that extend from the anterior end to the posterior end of the organism. The nucleus of the Trichomonas vaginalis is situated close to where the pelta and the exostyle meet. So here you can see this is the pelta and the exostyle. So where the pelta and the exostyle meet, so you can find the nucleus there. So pelta is nothing but a sheet-like structure of microtubules that actually carve around the flagellar bases, and the nucleus of Trichomonas is situated close to that. Now I'm coming to the genome part. So the genome is estimated to be around 160 megabases long and divided into 6 chromosomes. However, at least 60% of its genome was found to be redundant, means they are not functional. And this redundancy of the genetic material is maybe hypothesized that when they have emerged from during from the aerobic one to the anaerobic one, so maybe they have lost their functions. But this is a hypothesis; is not experimentally proved one. Now, what are the causes of trichomoniasis? So, a person can get trichomoniasis by having sex with someone who has it or who is a carrier. So typically it spreads through the contact between the penis and the vagina, and when a woman who have sex with a woman also gets this. If in that case sexual contact, vaginal contact is there. So women typically get this infection in their vulva, in their vagina, cervix, as well as urethra, and men usually get this in their urethra as well as in their prostate. So it has been observed that it's very rare to have trish in other parts of the body, such as mouth, such as hand, anus, like that. So they only infect the urogenital organs. Now the epidemiology of this particular disease. So high incidence of symptomatic infections occurs in women because the women have the following reasons. Only because of that, it is the woman who get more infection by trichomoniasis rather than the male. So, in the vaginal part of the womb, it causes not natural or normal microflora, the form of bacteria, different bacteria. And these bacteria, mostly they are lactic acid producing bacteria, they keep the pH of the vagina to 3.8 to 4.5. And ordinarily, this environment, this acidic environment, discourages the growth of Trichomonas vaginalis. So discourages infection of Trichomonas vaginalis, and because they cannot survive this low pH. But few cases it has been observed that Trichomonas vaginalis can survive the low pH, but they cannot grow. They cannot divide. So once established, it causes a shift towards the alkalinity. It means the pH is slightly greater than the normal pH of the vagina, so maybe 5 to 6. So it further encourages the growth of Trichomonas vaginalis. And the second one is that the presence of gene can inhibitory substances in the prostatic secretion is harmful for Trichomonas vaginalis. So trichomoniasis has been implicated as a cofactor in the other transmission, in the transmission of other viral borne sexually transmitted diseases like AIDS caused by the immunodeficiency virus. Now, what are the modes of infection? So, first, the modes of infection is that as the humans are the reservoir of the species. So, human genital tract or urogenital tract or urogenital organ is the habitat of the pathogen. And when both the female and male or both the female and they are engaged in sexual activities, they can transmit. So, they can means both the male and the female can develop two type of diseases. One is known as vaginitis, and the other one is active urethritis. So vaginitis, that is the infection in vagina and urethra, and urethritis is a infection in prostate as well as urethra in both in female and male. Now, how this particular parasite transmit? So, what is the mechanism of infection? So, Trichomonas vaginalis has a trophozoite form, and it is a pear-shaped form, which is most commonly observed, and an amoeboid form, which appears during the post-colonization. So, here, this particular pathogen lacks the cyst form. But, many studies have shown that the uniform in which trichomoniasis appears ovoidal rather than its normal typical pear-shaped form. So, in this ovoidal form, all these flagella are retracted in endocytic vacuoles, giving the impression of a cystic form. So, it's not a cyst, it's a pseudocyst form. So, due to this, due to the lack of a cystic wall surrounding the organism, many studies describes this form as a pseudocystic form. In its trophozoite form, Trichomonas undergoes cell division. Here you can see that multiplies by longitudinal binary division. So here you can see they undergo cell division through an interesting process which is called as cryptopleuromitosis. Here in this picture, this is described as cryptopleuromitosis. So in normal mitosis, there are three different processes. So three different common forms. One is the open form, one is the closed form, one is the pseudo-open or semi-open form. So in open form of mitosis, the nuclear envelope or the nuclear membrane disappears so that the mitotic spindle can interact with the chromosome. But in the closed form, here you can see this is the closed form of mitosis. In this closed form, the nuclear envelope does not disappear, but the mitotic spindle appear within the nucleus to separate the chromosomes. So here you can see that they appears here, and then here you can see that these are the spindles. These are the spindle fiber, and they are actually dragging the chromosome to the two ends, and then there is a longitudinal separation of the cell. Then have a different longitudinal segregation of the nucleus. And here you can see that In the second type, that is the closed form, where the envelope exists, does not disappear, but the mitotic spindle, they appear within the nucleus. They penetrate the nucleus through the nuclear pore to separate the chromosomes. And in case of semi-open mitosis, here you can see that the nuclear envelope remains intact, but the mitotic spindle they spears through the nuclear envelope to divide the chromosomes. So this is the semi-open form. So they are piercing through this, and then they are separating the chromosomes. But these three-way trichomoniasis will not obey this three-way. They are actually go for cell division using this method, which is known as cryptopleuromitosis. So what is the difference between cryptopleuromitosis and normal mitosis? So in this particular method, the chromosomes divide without breakdown of the nuclear envelope and without the injury of the mitotic spindle or spindle fiber. So here you can see these are the centrioles. The centrioles are there at the surface of the nucleus, and somehow they are dragging the chromosome at the two portion or the two end of the cell, and now the cell can divide. So here the spindle fiber, they are functioning exonucleus, means they are not entering into the nucleus. Means the spindle fiber is not penetrating through the nuclear membrane or the nuclear pore, and they are not coming inside. So although they are staying outside, but still they are dragging the chromosome at the two end of the nucleus, two end of sorry, two end of the cell, so that the nucleus can divide into two. So now the nucleus will divide longitudinally. So here you can see binary fission. So this is the difference between the cryptopleuromitosis and the normal mitosis, the three other forms of normal mitosis. So here we have seen that the Trichomonas actually follows this cryptopleuromitosis process. Now coming to the pathogenesis part, so they mostly their habitat is the vagina or urethra or the prostate because they are rich in glycogen. So they convert means mostly the bacilli, the normal flora, they mostly they resides there because the cells are rich in glycogen. They utilize the glycogen and then converting it to lactic acid. And this lactic acid is actually responsible for the pH of vagina, that is 3.8 to 4.4, 4.5. So under the normal microfloral conditions or normal conditions, the women have the vaginal secretion pH is 3.8 to 4.4, and this particular pH, the pathogen in Trichomonas, they can come here, they can survive this pH, but they cannot grow there. So this particular pH is controlling the growth and reproduction of the parasite. So you cannot see any pathogenics. So they are mostly non-pathogenic. But pathogenesis began when the pH raised up. So women under certain conditions, say they are pregnant or under pregnancy, or else they are undergoing menstruation cycle. So there the condition of the vagina will change. Now there is a disturbance of the lactic acid bacteria, there are other secretions, and these secretions is actually reducing the acidity, means they are increasing the pH, and the pH will be elevated from 3.8 to 4.4, and it should be elevated to 5 to 6. And this particular raise of pH in the vaginal environment is actually initiating inviting the infection of Trichomonas vaginalis. Now the trophozoites multiply very rapidly there under this particular pH and cause vaginitis. So this is how the pathogenesis of Trichomonas vaginalis began. Now, Trichomonas vaginalis is not at all an invasive parasite like the malaria parasite, Plasmodium. So it's a non-invasive parasite, and it remains adherent at the squamous epithelium, not entering into the glandular epithelium, staying there at the squamous epithelium, adhered there. And there are some virulence factor that is actually helping the parasite to adhere at the squamous epithelial cells. So first is the some protein releasing some proteases, and this proteases is actually and some protein solution, and this protein solution and proteases they are actually helping the parasite to adhere at the squamous epithelial cell. Then lactic acid and acetic acid, which lowers the vaginal pH to low, so they are actually restricting the growth of the pathogen. But these parasites they are releasing some enzyme, and these enzymes are the different enzymes, and one of the enzymes is cysteine protease CP39, and this cysteine protease is actually responsible for the hemolytic activity of the parasite. They are lysing the proteins and cell membrane of RBCs. So hemolytic activity of the parasite is responsible for for this particular enzyme cysteine proteases. Now, what are the types of human trichomonas? There are three different species of human trichomonas belonging to the Trichomonas species genus. What are the species? Trichomonas vaginalis, Trichomonas tenax, and Trichomonas hominis. Out of these three species, only Trichomonas vaginalis is the pathogenic one. But three species they are morphologically identical or similar. But Trichomonas tenax, which is a non-pathogenic one, inhabit the oral cavity, and Trichomonas hominis, that is also a non-pathogenic one, that inhabits in the ileocecal region of the GI tract. So in different locations they are staying, and they are non-pathogenic, not like the Trichomonas vaginalis. Now, what are the symptoms? About 75% people who got infection are asymptomatic, don't show any infection, any symptoms. In women, trichomoniasis may develop two different type of infections. One is known as vaginitis and cervicitis. So these are the two inflammation of the two organs of their genital tract. So they are feeling discomfort may increase during the sexual intercourse and during urination. Vaginal fluid is vaginal discharge, and that smells very bad and colors yellowish to greenish. And the woman may feel genital itching, burning sensation, redness and soreness, pain during urinating or during sexual intercourse. And also, they feel the need to urinate more often. And sometimes after sex, they can see bleeding from the vagina. Usually, symptoms appears in women within 5 to 28 days of exposure. In case of men, here itching and irritation inside the penis, and pain when they urinating or have sex, and the need for to urinate more often also develop here in male also. So they develop urethritis as well as prostatitis. So prostatitis and urethritis, these are the inflammation of the two organs. Mostly they are asymptomatic, and their discharge is non-purulent. It's not thick solution, but the smell, very bad smell. It feels like odor, and irritation inside the penis and slight burning sensation after urination. Now the complications for trichomoniasis, trichomonal vaginalis infections. So this is they can go for premature delivery or preterm delivery, and also deliver low birth weight of the child, and predisposing to HIV infections, developing cervical cancer, oral lesions, prostate cancer in men. So these are the complications that can develop by infection of Trichomonas vaginalis. And if we look into the clinical aspect, mostly for persistent vaginitis, 50% are asymptomatic. But discharge, vaginal discharge is there for 75% infected women, vulvar itching and burning for 50% of women. Then dyspareunia can also observe, that is sexual means painful sexual intercourse in case of 50% infected women, and dysuria means difficulty in urination is not at all observed in most of the cases, but bad odor of the discharge, vaginal discharge, is mostly observed in case of 10% of infected women. Now I'm coming to the diagnosis part. So when you are feeling this kind of symptoms, you have to consult the doctor, and your doctor can diagnose trichomoniasis by taking a sample of urine or fluid from your genital and genital part, and then looking it under the microscope to spot this parasite. But this is a crude test, the sensitive test, which is known as a nucleic acid amplification test or NAT test. It's very essential. Through this test, we can spot the sign of parasite. Doctors might test you for the other sexually transmitted diseases at the same time, because many people with trichomoniasis also develop gonorrheal infection and chlamydial infection. And vaginal scraping for direct microscopic examination and for culturing the microorganism parasite is very essential. And this is a sample for cultivation and microscopic examination for the parasite. Cultivation of the organism after vaginal irritation or pap smear examination is a normal phenomenon. And sometimes you can go for dot DNA hybridization assay. This is a costly assay, but you can get confirmed by this test. So if you are going for simple microscopic view, then you have to go for this following staining. This following staining will help you to accurate, means help you to rapidly diagnose as well as rapidly identify and accurate. These are very accurate methods. So actinic staining, then Tapinicolau staining, then James staining, Lisman staining, or you can go for simple microscopic view, and you can also go for fluorescent antibody staining. But this particular staining, this is very specific, rapid, more very sensitive, but still they are costly because you require a fluorescent microscope as well as a fluorescent probe for that. Definitely, this will show you the accurate data, but these are costly. Now to culture Trichomonas vaginalis, these are the two mediums. One is Kupferberg STS medium and the second one is the Diamonds medium, the modified version. And these are the two mediums you can culture Trichomonas vaginalis under there. And now the last one, this is the treatment part. So if you have diagnosed trichomonas, then you have to go for medication. So two antibiotics are prescribed. One is metronidazole. It is available in market in the form of flagyl, Inoritet or Nuvesa. Or else you can go for timidazole. It's marketed as Tingamax to clean up the infection. And in most cases, the symptoms of trichomoniasis in infected men may disappear within a few weeks without treatment. But pregnant as well as non-pregnant patients usually utilize metronidazole, but with caution, especially in the early stage of pregnancy, because there is a chance of miscarriage. So sexual partners, even if asymptomatic, should be concurrently treated. And prevention is better than cure. So prevention means avoiding products that can irritate the vaginal tissues, such as some feminine hygiene sprays, perfumes, powders, soaps. Never use that. And keeping your genital area dry and clean, it should be recommended. Sitting in a warm bath to relieve your symptoms, means some pain can be relieved by sitting in a warm bath using some antiseptic lotions. And wearing loose-fitting, airy clothes to allow the air circulation and reduce irritation to your genital part. That's all about trichomoniasis.